We have heard, and we'll be chatting later on, in fact, on this bulletin to DENOSA about their concerns around the vaccine and why they are concerned that they've not been given enough information, is what they've been saying. Part of the reason is that the vaccine, as was being said, is 89.3% effective, and I guess there's a concern around those remaining percentages. Why that remaining 11%? Why the concerns around whether it's safe? And of course, we'd all want it to be 100% safe, but I wonder if any vaccine is 100% safe. But of course, at 89.3%, I would say that is quite a good number. Those are the official vehicles that are coming through, as you can see them there on the tarmac at OR Tambo. I'm assuming at this point that in those vehicles is the president and the deputy president, who are to receive this consignment. Obviously, a very big thing this is, and certainly that is why we have the situation, of course, where the president and the deputy president are really at the foot of that plane to see that everything is happening as it should. Of course, my colleagues Sophie and Samkele had said that I should hand back as soon as the president and deputy president have arrived. I'm just waiting a second to make sure that indeed it is the case. All right, let me hand over. It is. I'm hearing that it is indeed. Let's hand back to OR Tambo. Sophie and Samkele, back to you then.
Dr. Zwelini Mkhize and the Minister, you can see the Minister of Health, Dr. Zwelini Mkhize. I'm just going to quickly doorstop him. Minister, the vaccine has arrived. I'm good, and you, Minister. How are you feeling? Okay, let's sanitize, Minister. Let's sanitize. How are you feeling, Minister, with the arrival of the vaccine?
Yes, we're very happy, and we're really looking forward to the reception. But we are quite happy that we've got the first million coming through. So we have indicated that we would like to get them coming earlier, and it's happening now, so we're really excited with it.
Minister, when South Africans, some of them have expressed a displeasure of the coronavirus vaccine. You look at the comments of a councillor in eThekwini, you look at the comments of the Chief Justice Mukhweng. What can you tell South Africans with the arrival of this vaccine?
We'll spend a lot of time focusing on sending the correct message about vaccines. We need to make sure that people debunk the myths about the vaccines, and all the suspicions need to be cleared. Everyone needs to understand that vaccines are here to help all of us, and so they need to participate. So those who have got worries and concerns and suspicions, we hope that the program of vaccination will clear all of that.
Thank you very much, Minister. We can't keep you since we can see the arrival of the highest office in the land. Sophie, you can see the arrival of the Minister, the President, and the dignitaries.
Yes, of course. Now we see the arrival of the Deputy President and President. They are here, as it was reported earlier on that the President and the Deputy President will be here to witness this important development in South Africa, but not only in South Africa, on the continent, because this will send a message to other countries that it is possible to ensure that countries are able to procure vaccines, even though it is a very challenging task, because the developed countries have bought these vaccines and placed orders in bulk, but South Africa was able to communicate with India and AstraZeneca at the bilateral level to ensure that the frontline workers in particular are able to get vaccines. I'm still here with Minister of Health while he's waiting for the President. The Minister, it was a challenge to procure this vaccine.
It has been a challenge because firstly, the playing field has not been level. The countries that had lots of resources were able to invest early, which we are not able to do. But also, once that has been done, it has been a challenge to reach some kind of agreement because of the global pressure of global demand. And so we are quite excited with this, but we are actually making lots of advances in getting additional doses. So we want to just say to people of South Africa, we'll be able to get enough vaccines to vaccinate all those that need to be vaccinated.
We are also waiting for Pfizer. the vaccines from Pfizer. But the challenge there, Minister, is the storage in terms of the requirement for the storage, the 70 degrees, minus 70 degrees Celsius. How are you going to navigate this? Because you have made an announcement that we'll soon get a consignment from Pfizer.
There are a number of laboratories, the research laboratories that are able to provide the storage at minus 70 degrees. We have identified them in the country. And secondly, there are lots of private sector coming forward to say that they can offer the required cold chain requirements.
Thank you, Minister. There you have it. The President is about to come out and check these consignments. He is still in the car. I'm dealing with security. I'm trying my level best to ensure that I respect the security, but also we are able to tell this important story after months and months of suffering since the coronavirus was reported in China in 2019, and of course later on the continent in 2020. I remember very well doing this story second week of January 2020 at the international level, when the World Health Organization declared that there's a crisis and there's an outbreak of the coronavirus. Little did we know that months thereafter, the world will not be the same. We are talking about a new normal. And I think the arrival of these vaccines will pave way for relative normalcy to return, because it will not be business as usual. It will be, it will take us complying with the health protocols, but also the pharmaceutical intervention for us to be able to deal with this deadly virus. The President will go and check the consignment. This has been a very difficult task to negotiate the vaccines, because as we have indicated, countries have bought lots and lots of vaccines. The Deputy President is here, and now the President is coming out. I'll try my luck. It's very difficult, but typical journalists will try to get a word from the President. We will try our level best. I think today the President is the happy person, because it has been months of struggle to procure vaccines, particularly for the frontline workers, because these are the people who are working very hard. Mr. President, I guess you are the most happy person in the country after months of speculation, and South Africans and also Africans on the continent crying loud that
Well, we are delighted. The vaccines are here now, the 1 million, and the Minister will outline everything after we have received them. But we are happy, and I will also be covering it tonight. Thank you.
Thank you, Mr. President. That's the President of the Republic of South Africa, President Cyril Ramaphosa, who is also the AU chair of the African Union. You had him there saying that tonight he's going to address the nation. We have a family meeting where he's going to talk about the way forward, but also saying that the health minister will outline process going forward from tomorrow. But I think it is now a scramble for the best shot. We must also observe the health protocol in terms of social distancing, and we hope that very soon these formalities will be concluded and people can go home. It has been raining, and you can see the President there with the Deputy President. When you look at these visuals, Samkela, the demonstration of collective leadership by the presidency on this important moment.
It really does demonstrate collective leadership of the government of the day, of the various political formations we have in the National Assembly. You did hear, Sophie, when you doorstopped President Ramaphosa, that when he addresses the nation tonight, he will speak extensively on the issue of the arrival of the vaccine to our shores. With the visuals you are seeing on air right now, you can see the engagement that's taking place between the presidency of the Republic of South Africa. That discussion now taking place between President Ramaphosa and his deputy David Mabuza. You can see with the visuals now, so if you're coming out, the batch of the COVID-19 AstraZeneca vaccine that is now going to be handed over to the presidency of the Republic of South Africa. This is a glimmer of hope for South Africans as it pours here at the OR Tambo International Airport. In Inoculation, the heavens have spoken. Prosperity is coming, hope is coming with the arrival of this vaccine.
There you have it, the Minister of Health, Dr. Zweli Mkhize, the Deputy President, David Mabuza, and the President now looking at this bash. The others have been offloaded already, and now this is the time for the photo op, or perhaps that moment where President Ramaphosa, as the head of state, is looking at this consignment. It was a difficult task to procure these vaccines. We have emphasized the fact that the developed countries have bought these vaccines in bulk, and they did place orders in advance, even before there was prospects of a effective vaccine. Because they have money, they were able to buy the dose or order dose to pharmaceutical companies who were involved in manufacturing of vaccines. And there you have it. I'll now hand over back to you, Flo, to continue. We'll indicate to you when you can come back to us.
All right. I will certainly keep our viewers busy while, of course, we await for you to come back to us. Of course, as you can see there, President Cyril Ramaphosa checking that consignment. He is with the Deputy President, Didi Mabuza, there, as you can see on his left-hand side, as well as the Minister of Health. Of course, we've been hearing very much from him in the past year with relation to COVID-19, as we've been battling really this virus in South Africa. Let's just listen into what's happening at the moment. It does seem that there is something being done or said at the moment. So let me just pause for a little bit as we give you those visuals there from OR. All right, well, the AXA team there helping the president out, of course, on this rainy day, of course. Just some information in terms of the inoculation program. Let's maybe just start with what's happened in India before I talk about what's to happen here in South Africa. So India started its mass inoculation program against COVID-19 mid-January, around the 16th, I believe, and it targeted core healthcare and frontline workers who were first in line to receive that shot. India detected its first case of coronavirus infection about a year ago, in fact exactly a year ago, if we can put it that way, January 30th, 2020, as the epidemic continued, as we saw, and as we were really getting quite nervous ourselves, as we saw it raging in several American and European countries. And now the number of new cases in India has actually declined steadily due to the issue of vaccines, the mass vaccination program that India ran. And I suppose one can argue that it is a successful vaccine operation or program that they had there, because they can now in fact give surplus, I suppose, of those vaccines to other countries at this point. Let's talk about South Africa then. All right, so 1 million COVID-19 vaccines have now landed then at the OR Tambo today, which is what the President and the Deputy President have, of course, been checking on. And the vaccines will be stored for about a week. We did hear the MEC for Health, I believe it was in the Eastern Cape, in fact, mentioning that, look, realistically, people will start to get those jabs in about a week or two as samples are getting tested, and then they'll start to be distributed throughout the provinces. So I suppose that 1 to 2 week time frame was indeed correct if we are to look at that. We do know that frontline health workers who work closely with patients, directly with patients, will be vaccinated first, because the first batch of jabs, as we know, won't be enough to cover all the healthcare workers in the sector. I heard there Sophie Mokoena asking about the next batches, and of course that of the Pfizer. And there have been problems about and questions around the storage and the temperature at which those vaccines have to be stored at. I saw the question being posed to the Minister of Health, and I think that he will certainly be talking more on that. And I suppose the President will also be talking more as we have what's now being called the family meeting. Let's go back then to OR Tambo. Let's talk to Sophie and Samkela. I believe you're standing by. Let's go back to you. Over to you.
Yes, indeed, Flo. The vaccine has indeed arrived and has been handed over to the presidency of the Republic of South Africa and the government of the day. The president did say when he was doorstopped by our very own Sophie Mokoena that he will speak extensively tonight on the arrival of the COVID-19 vaccine here in South African shores. As you can see, the visuals of the vaccine now, which was handed over to the President and the Deputy President and the Minister of Health there. We do expect the President to speak extensively tonight on this issue. We did ask and pose a question on when the second batch of this 1 million doses will be arriving in our... The vaccine is being moved now here at the airport as it does the airport. The vaccine put on to this particular vehicle. The BioVac trucks, which will handle the logistics of the distribution of the COVID-19 AstraZeneca vaccine to the various 9 provinces in the country, with the healthcare workers being the first in line to receive this particular vaccine here when it is distributed across the country. We are seeing the various Emirates personnel here fighting with us when it comes to the issues of safety and regulations here at the airport, but the vaccine is now about to be loaded into this BioVac truck and to be transported to where it will be housed for the next 10 to 14 days, with samples of it and samples of it being sent to the laboratory in the Free State for sampling and for quality control. As you can see now here, Flo, that the vaccine is indeed being loaded and is going to be transported out of the OR Tambo International Airport.
All right, thanks very much, Sam Gele. They're giving us an update, blow by blow, really, of what's happening at the moment at the OR Tambo International Airport. There, those vaccines are being loaded then from the plane onto the trucks, and of course, they will then be starting to be distributed. But let me just, I'm sitting on the coronavirus website that South Africans have been told to kind of stick to during the time that we've been dealing with coronavirus coronavirus. So that's really where the main information, the verified information, the correct information from the Department of Health is coming from. And let me just give you some pointers again in terms of how South Africa's rollout will work. So the National Health Department will coordinate the vaccine rollout with provincial health departments and the private healthcare sector. Structures will need to be established at a district level by the provincial health department to manage the mass rollout. The vaccine will be given out in 3 phases, beginning with frontline healthcare workers, followed by other essential workers and high-risk groups before trying to reach the wider population. Distribution of doses will become less targeted as more vaccines become available. And then how South Africa will get vaccines to the people. The vaccine will be delivered using 3 platforms during phase 1. Work-based programs, best for hospital-based staff, especially at district level, private and public hospitals. I suppose that's the easiest way, certainly, of course, to get those healthcare professionals to get vaccinated. Outreach-based programs using mobile teams moving between facilities, best for primary healthcare providers, community healthcare workers and private medical centers. And of course, vaccination centers, particularly in remote areas, which is of course ideal for independent healthcare workers. During phases 2 and 3, the same programs will then be used again with the addition of vaccination at public primary healthcare facilities. So some of those questions that you might have had, they are really there on that coronavirus South Africa, the website that the health minister has been asking us to really pay attention to, particularly when we have questions, verified information there. And if you're asking how South Africa chose the COVID-19 vaccines, they were guided by the following criteria. Whether or not the supplier has stock, whether the vaccine is safe, effective, and of good quality. And of course, we know, as I've said, these vaccines will be running through tests for about a week. They will be getting sample testers before getting distributed to the different provinces. The third point is how easy it is to use and how many doses are then required. I'm talking to you now about what guides, the criteria that the government used in procuring these vaccines, and then can it be easily stored and distributed? And of course that goes back to the conversation we're having about the Pfizer vaccines and the question, and I suppose the difficulty there is because the temperature it requires to be stored in might be a little bit difficult for South Africa to manage. So logistically, that could be quite difficult. And then another point here, does the supply have capacity to produce the volumes needed for South Africa's rollout? And lastly, how much then does it cost? So those were the guidelines that were followed by the government in terms of procurement of vaccines for South Africa. I believe Samkele is on standby. Okay, he's not there now anymore. All right, so this is what's happening currently at the OR Tambo International Airport. Those live visuals that we're bringing you from there as those vaccines, the first batch, have certainly arrived. We heard from the Health Minister, Dr. Zweli, saying that the vaccines belong to all of us. And of course, I've painted a picture now for you as to how that rollout will begin and how essential workers will be vaccinated as a first starting point. And how South Africa will ensure that vaccine is safe and effective. Manufacturers had to submit documents and data for their vaccine candidates to the South African Health Products Regulatory Authority for approval. The regulatory body has put in place steps to help expedite the approval processes once these documents have been received. So that's where we are at the moment. So I suppose in a couple of days, it's a week or two, people will be starting to get vaccinated. Interestingly, there was quite a bit of concern a couple of weeks ago when the Serum Institute of India, where we're receiving the vaccine from, was engulfed by a fire. So a big fire at the Serum Institute of India. It killed 5 people, in fact. But the world's biggest vaccine maker, as they pride themselves, said that this would not affect production of the AstraZeneca coronavirus vaccine. So I know that there had been some concerns from South Africa about that fire, but what was understood from that bulletin was that in fact it was just a small part of the factory, although it seemed as though the factory had been engulfed, but there were also other places where they store the medications and they store the vaccines. So although yes, there was damage and loss of life, in fact, due to that fire, certainly we were able to get those vaccines that were promised to us, as it is, as we can see there from these videos. All right, so that's the ending of our broadcast of those live visuals coming out of OR Tambo International Airport, where we've just received the first batch of much anticipated vaccines for South Africa.